I'm so honored to have the opportunity to chat with Joan now about her experiences as a breast cancer patient. Joan, thank you for joining us. I appreciate the time. First of all, the most important question is how you doing? How are you feeling day to day right now?
I still am feeling fatigued, because I've just come off of 16 rounds of chemotherapy, and I'm now in radiation. That's a very big attack on your bone marrow, basically, and it takes time. So my numbers are kind of inching back at a snail's pace. But, you start to feel a little bit better every day, and some of the side effects start to wane. So I can see the finish line, and that's important. Psychologically, that's important.
You tripped on a word. You said the word letter. And the reason I dropped that in is because you've been getting enormous mail, enormous letters of reactions. People from all walks of life are so touched by your story, having seen it on the Today Show, and they're emailing you now, texting in all different ways with all different formats. That has really affected you, too.
This has been the biggest surprise of my breast cancer journey, and it's absolutely the silver lining. And I struggled with the idea of going public. I don't know why I actually thought I could do this under the radar, but the idea of going public when you're a health advocate, I've always been a health advocate, out talking to groups all over the United States, telling them how to, prevent chronic illness and cancer, and then all of a sudden, you get cancer?
Yeah.
I don't know. I guess I felt I'd let them down in some way. I mean, did I bring this on? Did I do something wrong? I mean, these are all the questions that I think everyone asks when you hear those words, you have cancer. And then I went public. And the bad part of it is life is never normal again. Everywhere you go, everyone asks, how are you? How's it going?
That's not a terrible thing, though, is it?
It's a wonderful thing, but it does kind of focus you in on the disease.
Sure.
But anybody who sees you would feel terrible if they didn't start with that. But it does change everything. I remember my husband has said several times, this is your new normal. So it does consume your life. But this enormous response from the public via Facebook and Twitter and simply coming into joanlunden.com, I mean, they just come right to the website. I never would have predicted that. I love every minute of it. I don't consider it an imposition. I feel it as a reconnection with millions of people who I spent my mornings with for 2 decades in their living rooms or their bedrooms that are reconnected with me. They've then shared it with their friends. It crosses all demographics. And the fact that these people take the time every day to just write a little message back. We're praying for you. Stay strong. Or they share their tips or advice. It has been a very big part of my healing and of just keeping me strong.
I remember there's a quote from Shakespeare. It said, when mankind is touched by the face of nature, it makes the whole world kin, which means we're all one when we get hit with something that money can't control, social standing can't control. We're all a family, and you're feeling that family.
Absolutely.
I want to ask you some specific questions. You were triple negative breast cancer. How advanced was it at diagnosis?
I went for my annual mammogram like I do every year. And they said, you're great. In fact, I even had the 3D mammogram, which is a newer mammogram that, defines, I think, and shows a little bit more. And fortunately, I walked across the hall and I got an ultrasound. And the ultrasound showed a mass, and we followed it up with a biopsy, which confirmed that I had breast cancer. And, I didn't really know anything about dense breast tissue.
Right.
But I was lucky that I was a journalist. And I had been sent to do an interview with Dr. Susan Love, maybe 5 years prior, about mammograms. And we were talking about when should they start, how often should we have women get them, what about false positives? And in between changing the batteries on the videotape machines, she said, now you do get your mammograms all the time, right, Joan? I said, absolutely, every year. And I said, and I've never had a bad mammogram. They're always calling me back in. Constantly, they always call me back in and they say, don't worry, it's just hard to see things because you have dense breasts.
Wow.
She said, well, if you have dense breasts, you should be getting ultrasounds in addition to mammograms. So I came back home and I asked my gynecologist to also write me a prescription for an ultrasound. So all those years after that interview with Dr. Love, I followed up my mammogram with an ultrasound. Had I walked out of that radiology lab that day only having a mammogram, I would have gone about my merry way. I'm fine, and I would have had a fast-growing, virulent, rare form of breast cancer growing in my right breast. So, to me, one of my great passions is to make women more aware of their bodies, their breasts, and the fact that they need to know whether or not they have dense breast tissue. And let me just say, you can't tell by the way it looks. Okay? There's nothing about the way it looks or feels from the outside that is going to tell a woman that she has dense breasts. But when you go to a radiology lab and you have a mammogram, you should find out. And if you have dense breasts, what that means, let's talk about what it means. When they take a film when you have a mammogram, when you have a lot of dense fibrous tissue inside your breast, it shows up as white.
I see.
A tumor also shows up as white.
So it's invisible.
So it's basically like looking for a snowball in the middle of a snowstorm.
Oh, boy. Yeah. What were your treatment options, and which ones did you choose?
Well, I was immediately sent to a breast cancer surgeon right from the radiology lab, and they told me that I had a fast-growing tumor about 2.3 centimeters at the very, very back, almost against the chest wall of my right breast, and that there was another smaller tumor, quite a lot smaller, but about an inch in front of that, but nevertheless that would have to be treated, removed as well. But it's the pathology of the tumor that really determines what your treatment is going to become. And it was explained to me that most breast cancers are either driven by estrogen or progesterone or HER2, and I didn't have any of those receptors. Therefore, mine was called triple negative because I had been negative to all three of those. She then told me that triple negative breast cancer, really today, there was only one treatment for it, and that's chemotherapy. The good news is that triple negative breast cancer is very chemosensitive.
Good.
So then the next thing I had to do, of course, was to go to an oncologist. So 2 days later, I met my first oncologist because I also went for a second opinion. We can talk about that. But when and then I found out that there were several different ways you can approach treatment. I mean, every breast cancer is different, and the standard procedure is normally to have surgery, take the tumor out, and if you have triple negative, then it's then followed by a treatment of chemotherapy called ACT, adriamycin, Cytoxan, and Taxol, and that is then followed by usually 4 to 6 weeks of radiation. However, I was diagnosed June 5th of 2014, and there had just been a huge cancer conference, and the results of a study were released at that cancer conference. And it was a somewhat small study, I think maybe 800 women or something, which is considered, I guess, relatively small. But what they had done is they had done chemotherapy first. And the whole theory here is that they shrink the tumor down significantly, sometimes completely away, so that when they go in to do the surgery, it's a much smaller surgery.
Right.
But they also reordered the chemotherapy. They started with the T part, the Taxol, and they added in a new drug. It's not a new drug, but it's new to breast cancer, called carboplatin. And I guess this has been used in lung cancer and ovarian cancer and other cancers, but this was a study where they paired it with a 12-week course of Taxol. So you got Taxol every week for 12 weeks, and every third week you got carboplatin, which meant you got 4 doses. And it's, a pretty aggressive attack on cancer. But to my thinking, it means it's the best attack.
Sure.
Like let's just go. Let's
You
call
want
in
it-
the
you want
Army
aggra- you want
and
aggressive.
the Navy and the Air Force
Yeah.
as long as we're going to do it. Let's call in all of them and go all the way.
That's right.
And then that would be followed by the AC, which is it's a tough round of chemo. They call adriamycin red devil for a reason. I mean, not just because it's deep red when it goes into you, but because it's also a very, very toxic but very good form of fighting cancer.
How long is each course of this?
For me, and remember, this is different for everyone. That's one thing I learned, and I'm very careful when I talk about my treatment on social media because all of a sudden someone else might think that their doctor is doing it the wrong way.
Right.
And I never want that to happen. The way I was treated was 12 weeks of Taxol with carboplatin, and then that's to be followed by the AC, then surgery, and the smaller tumor was gone. It had been completely eradicated, and the bigger one had been shrunk by about 70%.
Great.
I did not get a complete response. But still, it was shrunk a lot, so the surgery was minimal. And now I'm in the final round, which is radiation, and I'm taking 6 weeks of radiation Monday through Friday.
Now, were you in any way disappointed not to have a targeted treatment such as Herceptin at your disposal?
Let me be really honest and candid.
Yeah, that's what it's here for.
I didn't even know anything about targeted therapy. I had never really, as a health advocate, I had done so much work when it comes to heart disease and work with the American Heart Association all the time. I'm always doing Go Red luncheons. I had done a lot of work in colon cancer because I had been doing a lot of health-related campaigns. I had done a lot of work with diabetes because I did all kinds of health media campaigns for Eli Lilly, and my brother had diabetes and lost his life to it. I had never really been well educated in the world of breast cancer. And let me tell you, once you hear those words, you have cancer, it's almost like you're shot out of a cannon at supersonic speed into the world of oncology. And the names of different drugs and what order do you take them in. And I got my first opinion, which was to go with this brand new regimen, and then I went for a second opinion to another renowned institution with a brilliant doctor who had a completely different opinion.
Did that confuse you?
Oh my gosh, no, you should start with the surgery, you should then do ACT, you should not do carboplatin. And you walk out of there, and my husband and I looked at each other and said, so which person was right? And this is kind of what treating cancer is like for patients.
Yeah.
There are numerous different ways sometimes to treat a cancer. They're both brilliant doctors. They both have ways of getting you to the end that might be equally successful. But we decided to go with this latest regimen, which seemed to us to be the one that would maybe give me my best chances for success and my best chances to not have a reoccurrence of the disease. I started my chemotherapy, and while I was in the middle of it, a genetic counselor came in one day and said, do you want to get tested for BRCA1 and BRCA2 or the whole panel? And my oncologist said, I think you should. For one thing, if you were positive, it might influence the way we follow you and maybe watch for ovarian cancer as well as breast cancer. And besides that, you have daughters.
Right.
And now that you have breast cancer, that's going to be an influence on them, and you need to know. So I got tested, and thankfully, I was negative to everything, the entire panel. So that's not something that I have to deal with.
That is good.
And that is good.
Was a mastectomy an option? Did you decide against it if it was?
It was never recommended to me because I clearly only had a tumor in my right breast. And in fact, before we got started on our chemotherapy regimen, they sent me for a PET scan. And in the PET scan, they look at your whole body, you take this radioactive liquid, and if you have a tumor in you, it shows up. Not a cancer cell, that won't necessarily show up, but a tumor will show up. So there's this thought that I have to say because, oncologists are going to watch this. I think that some women, when they get breast cancer, almost tend to think of their breasts as their enemies. And there's almost a thought of like, get rid of them, get them off me, because I don't want them to kill me.
Right, sure.
And they might make a decision to have a double mastectomy for that reason. The evidence in my case did not support that decision. There was no reason why I should have anything more than a lumpectomy on my right breast, and that's what I went with.